Working for you. A weekly talk radio program which highlights developments of national interest and the activities of your St. Kitts Nevis government. Join host Lesroy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts Nevis. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for You is weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for You.
Good afternoon, and I welcome you to Working for You. We are here, yes, we are here. It's the 4th week of January, but nonetheless, we are here. I am your host, Lesroy Williams. I want to wish everyone a very happy new year. From all of us, of course, at SKNIS, St. Kitts and Nevis Information Service. We're going to have this year a very eventful, it will be a very eventful year, I must say, and we look forward really to having many persons on Working for You who will share what the government is doing and how the government is working for you. Today we are going to be discussing the topic of universal health care. Universal health care was one of the manifesto promises of the present administration, the Dr. Harris-led administration. And things are being put in place to deliver on this promise of universal health care. And today I have with me Miss Azilla Clark, who is chair of the National Commission for Universal Health Care. And she doesn't even have to look on the paper. You know, she is so proficient with the material. Welcome, Azilla.
Thank you so very much, Mr. Williams, and I join you in extending the warmest of greetings for the year 2019 to all of your listeners.
Okay. Now, health is wealth. It is not the reverse. A healthy nation is a wealthy nation. A healthy nation has a more productive, energetic, and efficient workforce. A healthy population produces healthy lifestyles and happier societies. Being healthy in general is key to human development, economic development, and sustainable development. A country must have health institutions and systems and policies in place to educate about health, sustain a healthy lifestyle, treat illnesses, etc. This requires quality care from the health system in place. Today, we are here to speak about universal health care and how this will help to achieve the goals, not just of treating disease, but preventing disease. An ounce of prevention is worth a pound of cure. I think we all know that old adage. So let's start the ball rolling, Azilla. What is universal health care?
Certainly. Universal health care refers to, we say it has 4 components. It is a healthcare system that provides quality services with the required financial protection to all, I'm going to put that in parentheses, citizens of a country. Because it will come down to the country to determine who is the all. We have to do some soul searching to determine what exactly is the definition of quality services, as in time, specialization, qualification of the service provider, recovery time. There's some international indicators that we have to abide by as well. Their treatment protocol for diseases. So are we meeting these within our local context? And then financial protection. That is the ultimate question to ask. Health is now a human right. But with that right comes certain responsibilities, both for the individual and for the state, to guarantee that right. So how then will the responsibility of financial protection be shared? How will it be shared? And then on the responsibility side, with the state taking some of that responsibility, then what will the individual do? And those are some of the parameters that the National Commission for Universal Healthcare has been charged to explore in order to ensure that St. Kitts and Nevis gets one step closer to ensuring universal healthcare for the Federation of, and its people.
Okay, so we'll have improved access to health services.
Correct?
And also, you can say improve health outcomes.
Yes, for sure. That is, they call them key performance indicators. It is an indication to say, across the health spectrum, you stated it in your introduction, is to educate, because we want to prevent. So when you go for your annual physical, there'll now be information that says exactly how healthy are the various age cohorts, are the various sexes, is the various places in St. Kitts and Nevis. We've always heard the old adage that persons in the rural area have a perceived healthier lifestyle because they keep to more of our traditional values, whereas everybody in town went to a pharmacy every time you're ill, whereas somebody in the rural area say, you just draw this and this motion, you're good. So we have health indicators on the prevention side and then on the treatment side. When you get ill, how much education do you know about when do you seek care? And then once you access care, what are the parameters there? How long did you have to wait to get treated? Who saw you? Was it just a general practitioner or did you get specialist care? How did they speak to you in relation to educating you about your health, asking you questions, your confidentiality? Then it comes to then the medical interventions. What equipment was used? What treatment protocols were followed to ensure that you get the best treatment? And then the last point is follow-up. Did you take all of the information provided to you to get your best results? So if they put you on bed rest, were you really on bed rest or were you cooping around? They tell you must stay off the foot. Did you really stay off the foot for the 8 weeks or did you start to walk on it at 6? So it takes a discussion like this has larger implications for a federation, because if we're really about prevention, we have to put policies in place to make people healthier. Cost of food, type of food, exercise incentives, opportunities to import things that will make you healthier. So that is the goal. We want more people healthy than they're unhealthy. And then when persons have cause to become ill and are warded, you need to put the wraparound systems that says, do some people need home aid to make sure that if you have a broken leg, you are off the broken leg for 8 weeks, because you might not have somebody to come in and cook for you, so you're always hobbling around to the kitchen. Then you stump your toe and that aggravates it even more. So there are life realities in getting sick, and that sometimes people don't think about those things. But we need to think about it holistically in relation to service delivery to make sure that we keep you healthy for as long as possible. When the inevitable happens that you do get ill, we also put the systems around you to help you recover and then get better to go on to be that productive person.
Right. That word system.
Yes.
So health is not just about hospitals and
No.
clinics and so on.
No.
Health is an entire system.
Yes.
Now, what would make up that system? Because it simply means then, if one thing in that system does not work, it affects the entire system.
Yes.
It's like an ecosystem, isn't it?
Correct.
So what does this system, the health care system, consist of?
All right, it's the policies that says how will health be administered in St. Kitts and Nevis. Right now we have the policies that says children and senior citizens receive care for free or at increased subsidized care. We have stated that you should not have, there are certain distances that persons have to travel and no more to do so. That's why there are community health centers all around the country, the polyclinics, and the major hospital and the one subsidiary. Those are the decisions that nobody has to travel beyond a certain amount of miles to get access to health care. Then you look at the clinicians. Who are the professionals that are treating you? You want to make sure that they are highly trained and that they continue to be abreast of cutting edge technologies. So
you're talking ongoing formation.
Yes. So it's not to say that you graduated top of your class in 19X and then you come home and we expect you to treat you as the best in 19X. If you're not keeping abreast of cutting technologies that says you no longer remove this by cutting, you could do it endoscopically.
How do you ensure that though? Is it something personal?
No.
Or is it something that would be in policy as well?
It has to be legislated that says that these are the professional guidelines, because every association, American, Canadian, British, Australian, their medical professionals have standards to live up to. So you have to renew your license to practice in the country. You come home with your professional qualifications, but to practice where you now live, you have to continually go through certain things, refresher courses, whether it's your initiative or things that the association or the state does that puts on certain clinics that allow you to practice and be aware.
Yes.
And then by filing the paperwork that says that, well, normally they call them continuing education credits. I've done this amount of CSEs to be able to say I'm certifiable for the upcoming year. So, and it's at every level. Anybody that touches you. So from EMS to doctors to nurses, then you have the support systems, you have the therapists, the counselors, you have the dentist, you have the ophthalmologist. So it's across the entire spectrum that you will set standards for all of these clinicians. Then you look at where you're actually getting health care. The goal is to make sure that your hospitals and clinics are certified. There's this ranking called Diamond certification that everybody's raving about.
Yes.
So we're hoping to get our medical facilities up to the point of having international certification. So we can say we are 1, 2, 3 Diamond facilities in St. Kitts and Nevis. That requires a lot of buttressing and a lot of renovations and a lot of reforms within there. But it's not just in the public sector, it's also in the private sector. It is startling on one hand, but impressive on another, that in St. Kitts and Nevis, to set up a medical practice, you do not have to have anything beyond a business license. Now that is startling to any other person, because you should not be able to consider somebody's medical care without being certified by a medical facility or body or something. But it is impressive in St. Kitts and Nevis because the people in the industry have kept to their certification from where they came and got their degrees from.
Yes.
So I'm a social worker. I got certified in New Jersey. I keep to my standard of practice, to my American standard. All right? Because there's nothing in St. Kitts and Nevis. But as a social worker, I have to abide by my National Association of Social Work standards. So same thing everybody else would do. But it's time for St. Kitts and Nevis to determine which of the models, as I stated, American, Canadian, English, Australian, New Zealand, whatever standard or mishmash of all these standards do we set for St. Kitts and Nevis. All right? Then we look at our technologies. Are we saying that we're using cutting edge, or do we put in place a framework to get there? So we had the opportunity to visit the Turks and Caicos, and they did have a 4 Diamond hospital. And
4 Diamond?
4 Diamond hospital.
Never heard that before.
Yes. 4 Diamond. And every couple steps we took, they kept to remind us that they were 4 Diamond, because it is a major achievement for them. And so we saw the most cutting edge MRI scans, CT scans. In the hospital, there was a pool for rehabilitation. So that's the thing that we're talking about. Are we saying that there's certain standards that says by population size you're supposed to have a number of certain equipment to be able to service? So we have to make sure that those standards are there. Then we get to the ever important question of medical records. This always pricks a kitchen and division.
Before you move on to medical records, while you speak about health technologies and the cutting edge technology, that also has to go along with the training to use that technology.
Correct. And that's why I thank you for raising that, because kitchens have to understand, if we continue to demand higher quality equipment being used, then the state or the individuals as a whole must be prepared to be trained to that. And because we're in the developing stages, so if we say that we do have CT scan and MRI, let's say PET scans.
Yes.
We're able to go to that level and be one of the only ones in the Eastern Caribbean to have a PET scan machine. You need a technologist to operate that. That might take the person maybe a year, 18 months to get training, because they would first have to be a radiologist in the traditional sense and then get all technologists and then get the additional training. That takes time. All right, so it's not just procuring an equipment could be easy breezy, but then you have to have then you have to have the storage capacity.
Yes,
because a PET scan can't be just put in any room to store.
Right.
It has to have its own specifications to be placed there. So that's also something that we want persons to be aware of. I don't think there's anybody in the health fraternity that does not want St. Kitts and Nevis to have the best of everything. But they see it on a more holistic sense, which says that we need the people, space, and the maintenance protocols to keep it. Because if you bring it and then it's down, it might as well you didn't bring it, because Kittitians would never let you forget that it's down.
You don't have the technical know-how to fix it.
Correct. And then you have to tell them, I have to wait for the technician to fly in, and they say, why you bring a machine that requires... So they say, well, you didn't send off a man to be trained when you were thinking about it 2 years ago.
Right.
So they do have that expectation of us, and as technicians, we have to be able to deliver the same.
Okay. Now, you were speaking about medical records.
Yes. Yes. There's an interesting thing that happens in St. Kitts and Nevis. Right now, there is no legislation that requires physicians to share anything beyond simple data for communicable diseases, any TB cases, and those things that can turn into epidemics. They have to share that HIV, etc. And they give statistics as to, I've seen 6 diabetics, age, gender, etc. But not your baseline history behind of that. So when we tell persons, when we're going around to the country and we told them why we needed a universal healthcare system that shows that the percentages of diabetics, hypertensions, amputations, the cost of this, unfortunately we're only talking about the persons that access this care in the public sector. Now, as a technician, you want to be able to analyze the entire population, because as we always said, if we open the doors tomorrow and my data says that 40% of the population is diabetic, but that's only the people who seek care in the public sector, I can extrapolate based on population size, prevalence rates of diabetes, and say, okay, then I could probably expect another 20%. Then 50% shows up. And I've only budgeted for 70 when 90 shows up. What do I do? So it makes no conceivable sense when the opportunity is there to get it. So one of the recommendations is to be able to legislate the establishment of a national medical record system that will see baseline information on every Kittitian being inputted in the system, because once that is there, this is what it prevents. I could go to Dr. X this morning. I have a cough. He prescribes Buckley's. I don't take Buckley's for nothing, and I said I'm not taking that prescription. Then I go to Dr. Y in the afternoon, and Dr. Y gives me some fancy, nice tasting strawberry thing. And I'm like, okay, I can do that. But I do not tell Dr. Y in the afternoon all that I told Dr. X in the morning. So he doesn't know how long I've had the cold, what I had before, etc., because I just went in and gave him a bridge. So when he prescribes that, for me, he's only doing what's presenting when the Dr. X that I spoke to in the morning. So we need to be able to move it away from me self-reporting to the doctors having access.
Yes.
Because when they're treating you, they expect to have as much information, but they could only rely on what you tell them, and we are not always truthful when we go to the doctor.
Right.
So with that system, it takes away that, and they're able to see your full history, because I might have a cough every other month.
Right. But it is, for example, if I have a doctor and I am referred to another doctor,
Correct.
is it possible that my medical records can be released to another doctor? Is there something in place where that
Right. It's going to be both paper and electronic, because your initial doctor must grant access to your records to the referring doctor.
I
And
see.
the only how they can do that is with your consent.
Sure.
So there will be consent forms that
You
will
have
be
to
signed,
sign
right?
that.
The system will process it, and then when the doctor puts in his code to access the medical records, he can now have access to yours because you are permitted to do so.
Okay.
Obviously, then there will be the fax or the call that doctors say, well, Azula, I'm sending X to you this afternoon. Okay, cool. But no more do you have to wait for the records to come. It's going to be electronic. But with that comes certain protections for the individual. Because the major fear of Kittitians, everybody always know who does Lego your news in St. Kitts and Nevis, is to assure you that there will be legislated penalties for
people
professionals across the board. So it's from the clerk in the doctor's office,
who divulge information.
if it can be proven that your information was leaked from X, and remember, everybody has a code to get in the system, and everybody has security features within the system. So if I'm only permitted to go into module A, B, and C, but somehow the system lets me into D, and then we can go back in the system and see that you access D, or my my neighbor is a clerk here and she goes and she looks to my record because it's everybody in the country
Yes,
record, but I'm
yes.
not seen by her physician.
Right.
They can track all of that within the system, and then you can actually lose your license. You can be held civilly and criminally responsible for doing that, because we want to assure petitions and divisions that whereas we're asking a lot of you, it is to make the system much more seamless, but we do understand, we do want to protect you from the few, and I say the few because most of us in the medical and clinical professions, we like our licenses.
Sure. Suppose then an allegation is made against a health professional.
Correct?
That health professional then has to answer to that allegation.
Correct.
Who do they answer to?
Right. There is a grievance and appeals committee that will be set up within the National Health Insurance structure. So if there are, already you have that. I should point that out to citizens because they're unaware. Already the Medical Association can hear grievances against licensed medical practitioners
Yes.
in the Federation. Right? So if you feel you've not gotten good care, that you were seen by a doctor locally, they tell you you're okay, your family say come see me, and then the doctor over there say, well, you're sitting down on this, you say, but my doctor keep telling me I'm okay, and I know I feel a little pain or a little discomfort. You do have the remit presently to file those. An additional protection that within the National Health Insurance System allows is for that additional thing, because if every service provider is licensed as a service provider for National Health Insurance, we want to make sure that we are sending you to the best. So that we rely on the feedback from the users to tell us whether or not they're getting the best service from these individuals. So they can file their grievances within the National Health Insurance remit. The most we can do, because it is governed by fellow physicians and person in medical sphere. So they will know whether or not they did not follow your treatment protocol, they did not diagnose you correctly, they used fraud, whatever, because the doctors will be able to ascertain that. The most within the National Health Insurance remit is that you'll be cancelled as a service provider. But we are mandated by our laws to forward that to the competent authority to know if there's any further action that needs to be taken by the medical association or the medical board.
Okay. The same thing, I suppose, will come with malpractice.
Correct. Any service provider will need to have malpractice insurance to be licensed in St. Kitts and Nevis, and therefore, when that is, if it is found within the National Health Insurance remit, then again that is forwarded. The lawyers will take it from there, and then you will have to pay civilly through your insurance, and then there may be some criminal and professional ramifications.
Right. Now, with the implementation of this universal health care or coverage, will there be needed any sort of amendment or revision to the present acts that we have? For example, the Medical Act and the Public Health Act.
Yes, there most certainly will be. At current, the Medical Act only registers 6 medical professionals: doctors, dentists, chemists, podiatrists, opticians, and chiropractors. Those are the only people licensed to practice. Now, you see much people that miss out in there.
Yes.
So the new Medical Professionals Act will allow for professionals such as psychologists, social workers, therapists, nutritionists, all the gamut to run. And I probably should add here, so I can preempt the caller that is going to call me about herbal medicine. The issue with herbal medicine is that they're not regulated by any authority. They're not. Nobody in St. Kitts licenses them. So they may come home from their respective universities with certification in herbal medicine, but there's no guidelines. Same thing with me. I come home.
Except those that you buy in the pharmacy are not regulated, because they have. You, for example, I mean, I can go to my backyard and get some cattle rubbed down or whatever and so on. That
Yes.
I'm not thinking in terms of the dosage or
or the preparation of
it and so on.
Correct.
But when you buy it in a bottle in the pharmacy, manufactured in the United States or in Europe or something,
there are guideline directions as to how to use it.
Yes.
There are cautions as to what it is, because they
Right.
want to make sure that they're not held accountable.
Right.
That's the same thing. So when you go to a herbalist and they say they mash the moringa and they say prepare, Now, if the National Health Insurance is to grant license to that individual, the guidelines on the preparation of all traditional drug therapy must be regulated. Because I was giving a presentation like this to, I think, somebody, it was the Inland Revenue? Yeah. And one gentleman said, this is how he prepares his soursop bush. He draws it for 5 minutes. So I turned to his boss and said, this is probably what, if he's ever late, you know why? Because soursop bush is a natural thing to make you sleep. And then he takes it hot off the kettle, throw it on it, and draw it for 5 full minutes. I'm like, wow, you've drawn a very strong tea.
Yeah.
But that's what he likes.
Yeah,
but
because
when
in his mind, he's thinking it's more potent.
Correct.
If he does that.
Correct. But when you're mixing, I think Dr. Whitaker has one of the most comprehensive books on our natural herbal bushes and their properties, etc. So there's a science to all of that, because they must know what you're taking, because everything interacts with everything. So they must be able to follow the practice regimens in order to do so. And it is, with these revisions to these acts, it is possible for herbalists to be duly registered and regulated by the country, so that they also have to go to their continuing education credits to make sure that they're keeping abreast of whatever is the modern and current age and research, to make sure that they're offering them. So that's one, expanding the profile of health professionals in St. Kitts and Nevis to make sure you get comprehensive care. Because remember, I said at the last end is follow-up. Who is making sure to call you and make sure? Because two practices that we found out that has great propensity in St. Kitts and Nevis is this: your doctor gives you a 30-day prescription. You start to feel good around day 22, and you close up the man prescription, put it in your cupboard, and become your own doctor. No, you're supposed to take it fully through to day 30, because though you are not contagious anymore, you need the virus to go completely. Yeah. But no, we pay our own doctor. I feel better. I'm going to wrap up the man prescription and put it in my closet. Secondly, the same thing. They tell you must stay off of something. Stay in bed. Oh, no. We still got to cook. We got to clean. We have to run our errands. We have to have life happen to us. So the follow-up
Let's face it,
here.
none of us really likes people to tell us what to do, you know.
Correct.
And there are people who are very much set in their ways. And so the doctor is going to tell you, look, you have high blood pressure. Or you have diabetes. But I love mangoes, so I will sit down by my sink and I will eat 20 mangoes in one night.
Oh, yes.
And then in the morning I can't move.
Oh, yes. I when I was director of social services and dealing with senior citizens, don't you dare take them on a trip and don't put pork in their cook-up.
Right.
It was as though the heavens have fallen. And I'm like, but Tanti, you cannot eat. Miss got me dead from something around me pork in my cook-up. I'm like, but do you understand the liability you put me in to know that you've come to a state-sponsored function and I have given you pork in the cook-up for you to go home. You might not have testing strips. You may fall asleep. The next thing you wake up or your family visit and they say, well, who give Tanti the cook-up? I say, oh, when thing with Miss Clark and them, and like, but do not tell them no. I mean, one, they're older than me and I still have respect for seniors. So negotiating with them was always a delight. Because I tell them, Tanti, no, I can't. So I understand Kittishan's ways, eh? We know we're diabetic, but mango season, we can't do without it. We know we're hypertensive, we're going to do that. We know we're supposed to exercise. We're like, oh, well, I'm walking today. No, it's a brisk increase of your heart rate that it equals exercise. Not, oh, well, I'm going to walk today.
Habits are hard to change.
But they say if you do something for 2 weeks, it becomes a new habit.
Right.
So we just keep focus on change it for 2 weeks. And then you would see how it is. Because I had to cut out salt out of my thing. And it was like, just, Azella, count off the 2 weeks. That's the target. So I'm trying to use that now. We're cutting out sugar out my tea. Every morning the sugar still ends up in there, and I have to start back over my countdown. But I'm just focused on getting to 14 consecutive days. I say once you pass 14 days, it becomes a new habit.
Right. No, we have at the moment government insurance. Those who are working for government.
Yes.
Why is that not sufficient?
The question
I think it's with National Caribbean
Yes.
Insurance.
The question is asked by the persons not employed by the government. This. What makes your 6,000 employees different from me? Because though in 2015, around there, the legislation was changed that requires us to have a contributory system. It has not yet started. So where does And in this case, I always say human resource. So where does human resource get money from to pay for our insurance? From the consolidated fund. Who pays into the consolidated fund? Every citizen of St. Kitts and Nevis. So therefore, the ones who do not work for government ask the question, if my taxes is already going in the pool, how come you're only covering your staff? So the state now has to consider, how do we expand the coverage to the entire population that we offer to our employees? People accept it on one level. As an employee, yeah, it's good for you to cover your employees, but the government is always caught in that predicament because we do not contribute to our health insurance scheme. If we did, we might have had a better argument to say, but no, we're paying half of it. Okay, but no, the government right now pays the whole of it, and the rest of the country is asking, well, how come if you're taking it from the same consolidated fund that we are contributing,
that I'm not benefiting
from it as well? So that's also one of the reasons why the consideration to expand the package of services to include the rest of the population.
Right. So you are saying that it really involves coverage for everyone
Yes.
and for everything?
No. Well, I can't say no. That's the question. There are 5 key questions that the commission had to go to the country with. And that's one of the things. Who gets covered? If we say all is really all, and all we define as citizens, nationals, and legal residents, we're not such a generous country that will say all, whether you're illegal or not, you get covered. We are under obligations of World Health Organization to treat. So if a person comes here illegally and falls and breaks their leg, we have a responsibility to treat. But if that broken leg now requires physiotherapy, we will have to return you to your country of birth so that you can receive the additional service. But we will treat you for the broken leg. We're not going to leave you with it. So the question of who, then it becomes what are you covered for? If Kittitians are telling us that they would like to go anywhere in the world that they want and see any physician of the world, that costs you money. So once you're willing to contribute, we can design you a system as such. But we know Kittitians don't like to give up a lot of their money. So the comparison starts with what the government already pays for its public servants. The range of services, the co-pays, and the restrictions. And to look and to see, okay, the state pays X amount of money for that, and that seems to be a comparable base when you look at what other private insurance companies are offering as well as what other employers are offering. That seems to be middle of the road comprehensive coverage. So then how do we get that to everyone? Then it becomes, do you get everything from the day one that the doors open? Because the British Virgin Islands had that. They had a proposal that we will start to take your contributions in month 1, but you won't actually start to be covered until month 3 because we need money in the kitty to start to pay.
Yes.
Now, every time I say that in the community, I got one cut eye and a couple of suck teeth and be like, no, makes no sense because you can't take from me and I don't get coverage because that is what the system is designed to do.
Yeah, because it's not an individual.
Correct.
It's not based on an individual as such, but rather the collective.
The pool, correct. So the pool is there. Now, most governments acknowledge their responsibility to finance the pool. The startup funds will have to come from somewhere, and the state will be responsible for that because you have people today, this morning, who have new diagnoses and are considering how in the world do I pay for this. All right? And so that is something that you never want a person to consider. The changes or the decisions about healthcare based solely on money. It should never come down to that. So you want a system that will provide for that. So so you have the government system and it includes specialist care, overseas treatment, air ambulance and all of that. We have to make the consideration to Kittitians that we may have to do this in a phased approach.
Right.
How
much of the cost is covered now under the government insurance? How much of the cost is covered? The individual. For example, you go to the doctor, you spend $200. How much do you cover as the person, and how much does the government cover?
Under your
insurance,
as an employee of the government, through our National Caribbean Insurance Scheme, it is an 80-20 split.
80-20.
After your deductible.
Yes.
Let me put that out there. After your deductible, it then becomes an 80-20 split.
Okay, and what is being proposed under the universal health care?
Well, the ranges, we have a consultant team from the University of West Indies who is aiding, and it is looking at some ranges. The 80/20 is atypical. That's what most insurance companies would offer. We had some 70/30 options, and we had some 100%. It again depends on what we call the indicators of the state. What are the things that the state is most interested in knowing and having covered? So because remember, we already offer a system where children and seniors are free. And so and those are the populations that most likely somebody will have to pay on behalf of. And if they already enjoy I have to fully subsidized services, because nothing is free.
Yeah.
They enjoy fully subsidized services. The expectation then is for them to continue to enjoy fully subsidized services
Right.
on the national healthcare insurance. So that's where you get the 100% coverage. So the person knows there's no out-of-pocket expenses because the system will pay for me 100%.
Okay. Now, why is this universal health care so important for St. Kitts and Nevis?
There are two critical reasons why. One, we call it our burden of disease,
Yes.
and it's amazing some of the things that our data says. Neonatal death, are really infants. The two major causes are asphyxia and respiratory distress. Now that has to do with prenatal care, how a pregnant woman cares for themselves. We also have to juxtapose that with our birth population rates, which shows that our birth rate continues to fall because they're no longer the 12, 10, and 8 children families. There's the one done, named Carry On, and are going home to sleep. So we have to juxtapose that. So we need to make sure that all pregnancies result in a healthy baby because we're having so little pregnancies in and of itself. Then you get to infant deaths, congenital malformations. Again, that has to do with nutrition and prenatal care. So again, the guarantee that once you're pregnant, we will do everything in our power to make sure that that birth is live and healthy. Then when you get into the adolescent age, they're telling you that in 2011, there was a survey done, and I think the new one is due this year, that showed that 32.5% of our secondary students in 2011 were already overweight. And 14% of them were already obese. That's in 2011. Yes. That's just over the road there. That's like 7, what are we now, 9, some 8 years ago? Yeah. So where they 8 now, they're in the workforce. And if they've changed no behavior, they've gotten no corrective action, then you can understand now we have an employed population.
Sugary drinks.
We know that.
In the schools
yes.
and so on.
The survey also said that on average, our children consume 2 sugar beverages per day. And if anybody turned the side of that bottle, they would see the amount of sugar and calories in just one.
Yeah.
But then the question has to come, I often hear it is easier to buy $2.50 now for a soda?
Can they be banned in school cafeterias? Can it be banned? No, I mean some places are putting policy in place. Because when you think of it, people may say, it's my health. I do what they...
Yes.
I wasn't going to say that. What I want
yes.
with my health.
Yes.
You know, but at the very same time...
It is the public health.
It's public health.
Correct.
And this is costing, you know, the public purse. More money has to come from the public purse.
Yep. Yes.
You know?
Yes.
To care for
sick
people and so on in public health institutions.
I am with you. I know education tried it once to make like a safe zone around the schools so that trays can't come by. But we live in a system where unfortunately you make enough noise and no policy ever sticks. Because you can make every argument, but if people trying to make a living, like, yeah, but can you bring the fruits? Can you bring the healthy stuff onto the thing? I think at one time at early childhood they tried to ban corn curls and stuff and say bring a fruit. that took a while to catch
Yeah.
on. You understand? You remember the uproar, because to many it is easier to buy the pack of Conkers, a multi-pack of Conkers for this, and when foods cost you this and they can't last that long. So that's where we're also saying that this holistic change requires policy at every level. If we are committed about eating healthy, it must be easier, cost and convenience to eat healthier.
Yeah.
I remember one time this station used to do a lovely cooking show, because the other issue is that unfortunately we've not passed on our traditional values and techniques. So there are current parents today who do not know how to prepare ground provisions in a way that can make lunch, that can make a whole meal. Because when we're in social services, we say, well, buy a whole watermelon, because it will be more cost effective. By the whole watermelon,
Yes.
you make you juice some of it, you eat some of it there, and then you put it in a fruit salad. And they don't have the concept of multiplying it. That's why I always appreciate Windward Islanders who eat ground provision for breakfast,
Yes.
because nothing is worse than a Kittian who eats bread every day.
And in Jamaica too.
Yes. So how do we get them to understand that it is possible to make a light preparation of smash yuca and
Juca.
yes, and I want to say mashed potatoes, but that's not the healthiest
Cassava.
thing, right? Cassava or something. It is possible to make a light mash of that with a side portion of eggs and some vegetables, and that's your child's breakfast, as opposed to the bread.
Yeah.
And so people need to understand how to prepare these things, because unfortunately there's been a distinct cut and loss of that culture in
And the
St. Kitts
greens they
and
do in the morning to the callaloo
correct.
and so
Yes,
on.
yes, a blended fruit juice.
Right.
So that's how you're getting your fruits and vegetables, as opposed to when you get older and you're juicing every day because your body breaking down and you're like, so you're trying to catch up on it. But if you build these traits and characteristics in your children from young, then they will choose water over juice when having lunch. They will choose natural juices over that. They would say no to sweetened beverages because, no, I don't have a taste for that.
What is killing us most? We speak about the disease profile in the Federation. I know that NCDs are big.
Yes. Diabetes, hypertension are two, and we call them neoplasms, which is like cancers, are our major health threats in St. Kitts and Nevis. So it says that 70% of the persons living with diabetes are women. Now, I put an asterisk next to that because women have much better health-seeking behavior. So it might just be that we see the doctor more than you men. So I put an asterisk there for my personal study.
That's one way of looking
Yes.
at it. But we like to say St. Kitts women round up.
Well, that is true too, and we think back in what is it, 2009?
Sometimes we think the bigger the better.
Yes, the 2009 St. Kitts and Nevis had the accolade of being the most obese people in the OECS. I don't think we've cut down yet. So these are the things that are challenging to us, and they breed from inactivity. It's a cause of development, unfortunately, and because we don't do planning in a holistic sense, unfortunately one went ahead of the other. So Kittitians got a view that success meant house and car, and so every young adult, when they get their first job, it's not to put down for college, it is to buy a car. When the only thing I took from my accounting class was land is the only thing that I appreciate. So that was my first purchase in life. Up to now, I don't have a car. I'm struggling to buy it because as soon as you drive it off the lot, it starts to depreciate. And I can't wrap my mind about spending all of that money for something that's going to depreciate from the time I turn it. But life is telling me I have to eventually. But that's the kind of practice we have to do. So, how would it, I think it's African countries now are celebrating on the wellness days where you green the capital and people have to walk in.
Right.
No, I won't go that far to push Kittitians that way because I might get run out of town. But we really need to look at some concerted efforts to get that. We become really active with the observances, breast cancer, diabetes day, but it's not factoring into our actual daily existence. Because if it was so, men in particular, after 44, there's a particular test that you're supposed to take. your prostate exam.
Yes.
But the mode of delivery, I understand, is quite concerning for men. So therefore, they
yes.
put that off. They will be forever. They'll be forever 40, and then next thing, the birthday they celebrate, they're 75, because they just mean between 44 and 54, they're not taking that first test.
They prefer that to that.
Just over a mode of delivery, when perhaps if men would talk to pregnant women, they will understand there's nothing juicy about being pregnant either. You're pricked every week. They, at certain points, their person's up in your most personal business. But it's a part of life. It's the beauty of giving birth. So it's the beauty of aging. So we definitely want to make sure that we not only put on our shirts for observances, but that we also factor it into our own life. Where we say, you need to walk. And when we say getting exercise, as I said earlier, this is an increase in your heart rate. So you have to do something quicker or quicker step or something. You'll be able to, and it doesn't even have to be that. We have beautiful sites. There are people that hike every weekend or every holiday weekend. There are persons that go swimming every morning or afternoon. So there are these things to keep yourself active. And of course, it is our dietary choices. Sugar, it's not very good for us. Water is better. There is portion sizes. Now, we all like to get our big dinette set plates that have the biggest plate. It doesn't mean you need to fill the entire plate.
Right.
Though. All right, you're actually supposed to leave space on the plate. So it's portion sizes, it's inactivity, it is choice. And then we also we really do have to address the cost issue of eating healthier. If it is, it should be more cost effective to afford fruits and vegetables than it is to eat ramen and a sweetened drink.
Sure.
Because when the bottom line comes down to it, you will go to the thing and buy the bread, the
Because
Vienna
people who
sausage.
are poorer
Yes.
cannot
Who
afford.
can't make those choices.
They can't make
Correct.
those
They can't make
choices.
those choices.
Right.
But everybody should, again, just like our health shouldn't come down to money, prevention, eating shouldn't come down to money either.
Right.
So if we say Vienna sausage, hot dog sausage, and Franks are illegal because the processes in them is thing, we have to substitute it with nice fresh cut ham, and other things, and sausages and other non-processed sausages, turkey options, but they're more expensive. And when a person has to make
Sometimes
ends
people
meet.
go with what tastes good and not rather with what is more nutritious.
Correct. I have a very good friend of mine who's all health conscious, and she took me to the grocery store once, and I used to love Honey Nut Cheerios, and she turned the box and she pointed out the ingredient that equals cat tire. And I'm like, I beg your pardon, I'm eating tire? Why would I eat a tire? And after that I had to ban it, so now I'm just down to the ordinary Cheerios.
Okay.
And it took the 14 days to get me around to just eating the normal Cheerios, because they weren't as sweet as the Honey Nut
Right.
Cheerios. But then I had to realize I am not eating cat tire for nothing righteous. So I had to change. So sometimes knowledge makes key. She had me stop drink evaporated milk. Now I'm on to almond milk. When I grow old, I really have to thank her for it. But not
Right.
everybody has those pushy friends.
Right. And that brings me to another question in terms of, because you can't afford proper and quality health care without money.
Correct.
And so often when a person needs treatment for critical illnesses, what we are seeing, and we have seen it in the Kitchener Division Society, is that they must resort to sponsorships, and they set up a bank account at National Bank, and they ask people to donate and so on, because somebody needs to go and have surgery, or somebody needs treatment and so on. How will the universal health coverage assist with this?
Well, when we earlier defined universal healthcare, we said financial protection. Under the financial protection component is the national health care. We don't like to use the word insurance, because insurance has certain characteristics. It is prorated. So anybody that's ever took out insurance, when you sit with your officer, he goes and he asks you your age and certain characteristics, and they have a table, and then they will tell you what your probabilities are. We don't deal with that. We take you as you are, with whatever pre-existing conditions from day of operation.
Yes.
then you have the potential for increases in premiums and those kind of things. Because contributions will be regulated in the act that we stated, if there is to be any increase in your rate of pay, it has to go all through the legislative process. That is why forecasting what it will cost the country is important, because we must be able to set a rate today that will make it as sustainable within the first 3 to 5 years. Because to go back to make legislative changes, we'll be able to say that we weren't as thorough as we should have been. Now, I put that in along the lines also that we do need the cooperation of the public when the medical record scheme is established to contribute, because right now all that data I said again is only for people in the public sector.
Yes.
So once we now have a full epidemiological view of the country, what is the disease profile of everybody, then we'll be able to make better projections. So that might be the only caveat. So a national health care system is the pooling of resources. So, just like Social Security, it relies on the principle of solidarity. Those who can pay for those who can't. So, the healthy will have to pay for the unhealthy. All right? Because, again, we are covering the newest baby that was born this morning as much as we are covering, I can't even say senior citizens, but some of them are much healthier than I am. We're covering the young adult who already has hypertension, diabetes, and stress. So, we're covering you comprehensively from day one of introduction. So it's the pooling of resources. Where do we get these resources from? There is a plate, because there's no one financing source that can ever sustain a national health care system. The most popular source of funding is through wage deductions. All right? I just said that's settled because your listeners might have just raised their high blood pressure on that. The most common one is wage deductions. Now, St. Kitts and Nevis enjoys the unique place of only paying 8.75% in deductions every month. If anybody has ever had other friends around the region, you will know just how blessed we are as a people. Because there are persons, I just came from St. Vincent for my holiday, and my friend down there pays 20-something% of her salary in income tax, plus VAT, plus Social Security. So we do have thresholds within, from examining it from a macro system, we do have space within the deductions made from wages to do so. Now when you get to the one-on-one basis, I already don't take home nothing, how you going to take something else? We understand that struggle. That's why it takes education beforehand to let people know, well, this is what, when the actuary and all others consider it, this is what the threshold will be. And then the legislation should come in place in X amount of months, so persons can make the individual adjustments, right? Because it will be a new deduction. So that's right. First. Then, as you indicated, right now, I think health is also considering increase and new taxes on what we call sin activity. Gambling, lotto,
what you call
cigarettes.
It? Sin activity?
Yes, they're called sin taxes.
Sin taxes?
Yes.
Why not health tax?
Well, because the traditional language says though that you tax the things that are bad. Though. Yeah. Well, they say the things are bad.
That can be a theological debate. But
right.
There might be bad habits, but are they really sinful?
Right. And you remember back in the good old days, anything bad habits, everybody used to shake it out of you and say, no, it's sinful. So we still have some of that history with us. So it's the gambling, it's the lotto, it is cigarettes, and it is alcohol.
Become sinful,
correct. And alcohol. And so the new one now will be sugary-based drinks. Being able to tax that. There's a further exploration about trans fats. So if a restaurant only fries stuff, they may be exposed to a higher tax profile because their menu exceeds what the trans fat profile would be. But that doesn't mean that they can't change it and offer you a salad here and there and something else healthier. So that would show now that, so they say, oh, you're taxing them out of existence. No, I'm taxing them to change. So how would you like to put your fried chicken, sprinkle it on a little salad and make a nice Caesar salad for the day, as opposed to just selling fried chicken and fries? Right. So it would precipitate a lot of change. So, but the plate of options would include direct salary deductions. It will include designated taxes from sources. It does have some government interventions because there will be some populations that the government continues to be responsible for. Seniors, children, disabled poor, vulnerable persons. So they'll make those contributions on behalf of those individuals. And then there is the option for investments, but that is more of a long-term option, because that's something that one of the other questions that is Skitishans have to answer is who will manage the system. The two options are statutory entity or social security. Persons have, owing to some of the investment decisions of social security, they've lost some confidence amongst the public, and so that's why we are leery to mention investment for national health insurance, because national health care, because it is more of a long term, but it's about taking some of your funds and putting it away for a rainy day. Everybody understands that concept, but where they put it and stuff will have to be governed by skilled personnel who can look at what, and as well just manage with the expectations of the layman, because sometimes we forget that it is ordinary people making funds available for people to invest. So while we have the greatest investor minds, they also must be cognizant of the individual's money who they are taking, because when things go wrong, the individual does make their point clear. So we will have that sort of plate to be able to choose from. So but how the plate is divided into portions, that we're getting some technical support to advise.
Okay. So we have to go to the phone lines, and I'm sure people are waiting to call. The numbers to call, we are going to open up the phone lines, are 465-2555, that's the local number, and the overseas number is 1-718-577-2916. That is 1-718-577-2916. We await your calls. Working for you, good afternoon.
Good afternoon, Mr. Williams.
Good afternoon.
Yeah, good afternoon, Mr. Williams, and to the lady there from the way.
The National Commission for Universal Health Care.
Oh, the National Scheme of Workers and Health Care, okay. Now, wonderful program and a wonderful suggestion to the people that this incoming scheme, because many of our people sick, and just that because we ain't got it to go overseas, we can have got to die by that to get further treatment overseas. And good thinking for the government doing this thing for the ordinary man and woman in the Federation. Now, question, this program is for every national, whether you're paying tax or not. Whether you're working paying tax or not.
The language
because you got some people working for themselves, they don't pay tax.
Oh, okay.
They don't pay social security. They don't pay nothing, no house, land tax or nothing or whatever. So I would just like to know if this scheme belongs to everybody, whether you pay tax or not. If you take sick by accident or whatever, and they got to go away to get medical treatment, further medical treatment. If a person like me, maybe I don't pay tax, I don't pay social security, and whatever, I may be working nowhere. If this scheme goes to me too, or goes to anybody who's here, I will refuse to pay the tax. I will not be here.
Okay, thank you for your call.
All right. To the first caller, we call that coverage. Coverage for us is defined as anyone who pays or who has paid on their behalf the stated contribution. So who exactly is eligible to pay or have paid on their behalf? We're talking about the employed population, so persons in the workforce. Yes, the opportunity will be offered to the self-employed as registered with Social Security. There is this classification that's called voluntary contributors, because we understand there are persons who are not presently working, are not yet senior citizens, may be enjoying some benefits from overseas. So they have the opportunity to pay into the scheme to be covered as well, pay into the system to be covered as well. Then you have the populations that the state will most likely be able to cover. Children, we say anybody up to age 25. You have senior citizens, anybody 62 or over. We do have another caller.
Working for you, good afternoon.
Yes. Good afternoon, Mr. Williams and company.
Yes.
I want to thank the Minister of Health for their vision in bringing this program here forward. Now, my question is this. Now, I like the adjective that the young lady David you use. Coverage. Whether you're working yes or not, coverage. But what should happen to a young man or a young woman, a young person who far from being 55 and they are self-employed and ignorantly they're saying that they're not paying no money into the social security because of all kind of what you call accusation. They casting spurgeon on the social security place. And they refuse to pay social security. Now suppose something should happen, God forbid, urgently, and they need emergency attendance. And they have to be flown away overseas. Now, will the coverage take up that? If that person refuses to pay, they have no record of contributing to the welfare of the country. Thank you very much.
I think that's an excellent question, actually.
Yes, that's the population that give us most concern, because that's well, in two folds. There's the unemployed population, and the International Labour Organization defines the unemployed as people who are actively seeking work. But we all know that there's a population in St. Kitts and Nevis that are quite work averse right now, because unfortunately we've told them that it's possible to get everything you want without putting in any legal, active, productive activity. So that population is not in there. They'll be classified as vulnerable. And within the Ministry of responsible for social services, they have systems in place to try to get to the bottom and what we call case manage such populations to return them to a level of productivity. All right. So there's that consideration. But if the case that the caller brought up, if somebody is self-employed and registered with Social Security as a self-employed person, and they're refusing to pay Social Security and the National Health Insurance contribution, that will be illegal. Now, Social Security already has the concept that even if you as the payee had deducted from your wages and somebody didn't pay into it, you will still get coverage. So that is the scenario that gives us greatest pause. Where we would like to put it back on the population is because the plate of financing also includes deductions from every person. This is an excellent opportunity for us to help to return to a sense of community cohesion, because that young person must live with somebody, and hopefully that person they live with will begin to strongly encourage them to pay into it, because that person, chances are, would have already received some benefits from it. And so they can see that nobody in a stupidness they're talking about. If you're paying the money, when you get the 20% that you have to pay for is a little bit of money, they're covering more. Because I can see
what
persons...
about if a person does not want?
There's no want, it is mandatory.
So it is compulsory.
It is compulsory. Or I
so
should have
what
started
about
there.
private insurance companies?
Well, that is a decision that individuals will have to make. If you presently have a private medical insurance, when the national health system is launched, you have to make a determination. If the benefit package offered by the national healthcare system is comparable, which is the same, or better, then you can choose, because you have to pay the national health into the national healthcare system. Then you choose to do that. What we've seen in other jurisdictions is that the private insurance companies then begin to revise their benefit package to supplement what the national health insurance does not do. All right, so that way you can, so if you enjoyed a platinum package to your employer, and your employer says, well, okay, now that there's national health insurance, I don't have to cover you anymore, but they can keep whatever portions of the plan that is not in national health care. That is always a decision that every individual and employer must make, because this system now becomes mandatory, because as the gentleman said, health is now a universal right.
Yes.
And as a citizen, you are still responsible for, as a government, you're still responsible for everybody. Right. So that is the sticky area, because right now the government is responsible for every person in the country. Because even though persons whether you are covered or other, you always come to the States and say, I want an advance on my salary, I would like some social assistance because I have to go away to seek medical care. This system now allows us to finance it more comprehensively. There's someone else.
Working for you, good afternoon.
Yes, good afternoon to everybody here.
Yes.
The young lady, good afternoon.
Pleasant good afternoon, sir.
Here's the question I want to ask you, because I believe the first caller, I'm not too sure if you answered the question. If a person all his life worked here in St. Kitts and did not pay, refused to pay, is not a part of this health scheme in any way, financially or otherwise, and he took sick, would he be eligible for some kind of assistance from this national health insurance? I think that's the question I really would like. I don't know if you answer it, but I'm listening to the program and I don't think I understand what you're saying. So if somebody work all his life, based on the question I got from the first caller, and refuse to pay, that there's some people who refuse to pay Social Security, would they be eligible for this new scheme, this health scheme? I'll listen off here.
Okay. First, it is a mandatory system. So I would imagine you're talking about the self-employed population, because that gives Social Security some hindrance, some issues as well with compliance. But it is a mandatory system, so it would not be possible for you to work and not. The two systems will be able to speak, because what a country with Social Security and National Health Care does is most persons are more compliant paying for health because they know they can get ill at any time, and the benefits to be derived from contributing, they stick to paying those, and therefore Social Security and the National Healthcare System would speak, and Social Security's compliance rate actually increases in such cases. But if a person flatly somehow manages not to ever pay a contribution, there is a category in the beneficiaries called the vulnerable. It is a vague term because it can encapsulate any other group. So if this person shows up and they do not have the financial resources, actually somebody will be paying for them. Right now, the government, the state, I was told to stop saying that because we're just statehood, but the government, the entity that runs a country, would be paying for all children, all senior citizens, the unemployed, the poor, and the vulnerable. So I would hope that persons would let us know of such persons that are working but refusing to pay, so that we may be able to register them appropriately as vulnerable, and the government will be paying their contributions on their behalf. But if they happen to show up and be missed by everybody and show up at the hospital, and they will not have a card, they will not have, because health is a right, the decision still has to be made whether or not it is national health insurance, national health care, or the government who will pay for his health care.
Okay.
But somebody still has to. I understand there's another call.
Working for you, good afternoon.
Yeah, I have to come back here.
Yes.
Because I think what the government should do is that there should be compulsory contribution in some way. As long as you can prove to them that you were able for many years to work and you ain't put in no contribution, I don't think the person should get anything nationally, because you got people ignorantly said they're not going to pay no Social Security. They're not contributing to that because they call them all kind of name. So I don't think that kind of person there should be eligible to get no help from no government like that. I don't think so.
Okay.
Yeah, that's my view.
Okay, thank you. Before you answer that, Azila, let me be the devil's.
There's another one.
Working for you, good afternoon.
Good afternoon to the panel.
Good afternoon, ma'am.
Yes.
Yes, go ahead.
What happens to someone who has been paying insurance for over 30 years when you all are saying this thing is mandatory? What should that person do with their insurance?
Okay.
Some persons have more than one insurance. So you should let people make their choices, their decision, not pushing something down somebody's throat. This is not fair. Could you explain, please?
Okay, fine. I think that, Miss Clark, that this caller has a point.
Correct.
And the point is that, is this the best model? And are there other models that are presented to the population? For example, I know that you are going around and doing consultations and so on. Are there other models presented to people? For example, you may have the single payer, the tax-based financing, you may have social health insurance, and then private insurance, as this caller was talking about, that they have, and community-based. And so there are different models of health insurance. And this caller feels that, look, this is something that has been foisted upon me. It will be foisted upon me. And she totally has the right to feel that way. So my question is, given the choice, how do we determine that this is what the population really wants? And do you place before them at these consultation options in terms of different models of healthcare?
Because of our health profile, the dialogue has moved beyond what an individual might want as an individual to what is collectively needed. Again, what
the question I will ask is, how did it move from what is individually want to what is collectively needed?
I'll tell you.
Was there some sort of a study done? Was there some sort of a, I know you have consultants and so coming in here. Was there sort of a collective, was there some sort of a consensus? Was there some sort of a, finding out from the people what is best for them? I don't know. You tell me.
Well, I guess that's one of the challenges of being a technician. You study a lot of data and best practices, and you don't always go to the people with the thought. You have to do a level of preparation, because the single payer model is what actually we're preparing, where you have everybody contributes and there's one pay, which is that system for the United States was challenging, but the UK has it where their national insurance system, actually no, it pays the health benefits on behalf of all. All right, that's what we're hoping to have, a single pay where we pool resources together and we finance your health care.
Sure.
Now, depending on the benefit package we have, it might be necessary for you to continue and have supplemental insurance. But based on the health profile, we want to cover as much things as is important to keep the country productive. All right. A combination of I think the Prime Minister of St. Lucia proposed that one of the options he has is to simply mandate insurance, and you get it from wherever private insurance company you can have. The difficulty with that is that it comes down to your ability to pay. So a mother of 5 cannot have the same comprehensive coverage as a female like myself with none, because my savings and income budget expenses will allow me to take a package that is higher when she might only afford the $34 package, which may just be doctor visit and stuff. But I have the air ambulance, I have the specialist, and I have the drug coverage up to $100, because health should never come down to your ability to pay.
That's right.
So that is why the dialogue has been taken up. Now, there is opportunity for the private sector. Let's not say that.
Access to health services should not bring with it financial burdens or hardships upon
it should
the
not
person,
be
as we are seeing today.
Correct. And if if no, insurance companies might say differently. But if it was not a business, I'm sure they would love to offer comprehensive care cost effectively to all persons, because I'm sure their heart aches more than us when they hear both from their subscribers and not that they're not covered for whatever it is. But the business of insurance is not into that. All right, that's why they rate you.
Yes.
If my age, my presenting health issues put me in a certain bracket, I would have to pay $250, and if I can't pay $250, then I must, for what I can afford to pay, my benefit package would be less. All right, that's the business of insurance, but it should not come down to ability to pay. So yes, we are cognizant of the fact that, like good citizens, there's some persons from the age of 18, their first job, went out and got medical insurance. They've been paying for that all their life, and they're now 40-something, 50-something. And here comes the state saying, I now have to introduce a national system. Almost, it seems, to cover those who've not been as diligent as you. Because the one proposal by the former administration was to simply take out a package that covers the poor, the vulnerable, industrial site non-covered by insurers. Take that call and I'll continue.
Working for you, good afternoon. Oh, there is no call.
Oh, okay. That was one proposal. The challenge for the state is the financing for such a package. Because again, I think that was where the source was going, to make government employees co-pay, so that some of that coverage now could be expanded over. But we are delayed in that fact. So if we would like to cover the poor and vulnerable with the same tax profile, the state will have to do some adjustments. There's a call now.
Working for you, good afternoon.
Good afternoon. For
Yes.
someone who is receiving Social Security,
Yes.
how much would be deducted from that person's or person's social?
Nothing. If a person is on fixed income, which is a pension, that is a category of persons that the government will be responsible to pay their contributions for. Because remember, we're not in the business to make persons any poorer.
Right.
All right, you have a fixed income, but if you happen to be working and earning any additional income, that income will be taxable, but not your pension amount. I hope I answered the question correct.
Yes, okay.
Right, so the senior citizens on
We do
fixed
have a
income
caller.
do not have
Working for you, good afternoon.
Here's another question I have for you all here. Good afternoon.
Good
Good
afternoon.
afternoon.
A person have a medical insurance, a private medical insurance. The government introduced this insurance that you are hoping to introduce, I would assume by sometime this year. Now, some of these medical insurance, you pay part, and the insurance pay another part. In the case of the insurance that is about to be introduced by the government, do you still have to pay part of, or supposing the person decides, well, look, I have a medical insurance, but I have to pay part of the insurance, so I prefer to deal with the government insurance, who may not be requesting that I pay anything. Would that be the case? At the start, you should have asked the question.
Okay,
I'll
thank
listen
you,
up. I'll
thank you
listen
for
up
your
here.
question.
Sorry, if a person is paying insurance,
Could you repeat the question?
he left? Sorry, I was taking
Oh.
he left? Oh, sorry. Did anybody recall what he said?
Yeah.
My sincerest apologies. Carrying 3 different hats this afternoon, and I was taking an urgent call from a consultant. Message from a consultant. If you
Could
can,
that caller
yeah.
call back? Good afternoon, caller.
Hello?
Yes. Were you
I'm
the one who
here.
called before?
Yes, I'm
Okay,
the one
cool,
who
cool.
I called a while ago.
Could
Okay.
you repeat your
So
question,
you're
please?
paying insurance?
I'm paying a medical insurance.
Yes.
The government now also have a medical insurance
Correct.
that I apparently can tap into.
Yes.
Now, in my medical insurance, I may have to pay part of what? Let's assume that I have an injury. Instead of my insurance paying the total amount, they may pay part and I pay
Correct.
part. But in the government insurance, and I just said, well, government insurance might be much better. Can I tap into the government insurance?
Yes. The National Health Care System will be your first pay. So
even though I have
even though you have
medical
private,
insurance.
yes, even though you have private, the first person to pay for any medical situation is the government scheme. Anything remaining, your private insurance can cover. And trust and believe, private insurance companies are very keen to ask, have you claimed first from the government system, and is what remaining now comes down to us to pay. So
Excuse me, do you have a maximum you can claim from government?
well, those are the things that our actuary are working out on for the benefit package to see whether it is, because one of the questions had to be the consideration of a lifetime limit, or presently within our government health insurance system, it is a limit that is renewable every, I think right now it's 3 years.
Okay.
Right. So we have those kind of options to consider, and the actuaries punching the numbers to see. The public is not in favor of a one-time value, because let's say we set the value at $1 million. There are some persons with health situations that $1 million can be wiped out, and how then do we tell them for the rest of their life there's nothing? Most persons are moving towards the renewable rate that says you get a 3 years of, I think it's right now it's a $750,000 is the government insurance. The insurance that the government has for its employees, let me put it that way, is $750,000 renewable every 3 years.
So then you tap into the government's resources first.
Correct.
And then after you tap into yours.
Correct.
Okay. Thank you very much.
You're most welcome, and I apologize for that gap.
No problem. No problem.
Okay.
No problem.
Okay. Good. Now, in terms of, we have to be wrapping up just now, but in terms of service providers, I suppose that contracts
Yes.
will be entered into with
Yes.
service providers, and these service providers must meet certain criteria
Correct.
as well. So they have to be registered, I would, and so on, and other criteria that they are providing quality service. And who polices this?
Right. Within the National Health Care System, there will be quality assurance and case management systems. So what the quality assurance is, they'll be doing satisfaction surveys. So within every quarter, they take a cohort of the number of persons that have been paid benefit for. We send you a quick questionnaire. Did your doctor do this, and this? Are you comfortable with them? They normally call them key performance indicators within the system. We will say, to maintain with us, to be a service provider, you must maintain a 60% satisfaction rating every year. So when we sample from the people that have service for you, you must continue to maintain a 60% rate in order for us to say you are doing well.
Okay.
And that is how we make sure that the public knows that we are only offering you the best service providers. So when you talk about that, they will first have to be registered to practice in St. Kitts with their insurance, etc. But it's not something that they are one of our service providers today and they maintain forever. If you do not keep offering quality service, you will not continue to be a service provider.
Right. So the person will be given a card as well, and that card will be able to be used internationally.
We are looking at providing those sort of networks but the care profile says a lot of people are disbelieving, but within the Caribbean region, that includes Latin America, our southern partners of Cayman, Turks and Caicos, etc., and all the way down south to Trinidad and Guyana. Within that network, with the exception of particular specialized areas, most specialties reside within the region. All right, so it is an opportunity for us to make those connections to do so. Now, where there is requirements for subspecialties, then we'll have to make connections overseas. One of the other questions that normally came out in the consultations has to be, what happens if you're already overseas and you take ill? That's where we have to make sure that we have brokers who accept our card and are able to have you service wherever in the world you are. But it's not to say that you can get ill here in St. Kitts and demand to be treated in the UK because you have family. If we can get a comparable service provider within the region, you will have to make the choice of, just like other insurance companies, I can only pay you what I would have paid had you gotten the service within our network. And that then is what you'll have to go to England or Australia with.
Right.
So we're not telling you absolutely can't go, but we're saying we can't pay you more than what we would have paid had you gotten the service done within our network.
Right. Now, I'm hearing a lot about regulation
Yeah.
and monitoring and evaluation and all of that. Does this then mean that the Ministry of Health has to be strengthened
Yes.
in terms of, you know, the way it functions and to put things in place? Not that there are things that are not in place already, but to improve upon what it has already in place.
Yes. The Ministry of Health by law has the responsibility for service, policy, and regulations. They do the service already. We have our health center network. They do our policy already. They put out their strategic plan. It's the regulating that would need to be buttressed. Earlier we spoke about once the Public Health Act is amended and now service providers must also first be licensed by the medical authority, have your business license, and then open your doors. These are the inspectors who now come to the pharmacies and make sure if they say that your drugs are supposed to be stored at XYZ Fahrenheit, they're the ones that are checking to make sure it is stored accordingly. These are the people who will be going to the labs and making sure that their test equipment is calibrated correctly and maintained. Take you off, you can be renewed in your license, just to make sure that persons are keeping up with best practices.
Okay, now we've spoken a lot about what universal health care means. We need to talk about a little bit about what it does not mean.
Yes, yes, yes. It is not free. That is a word in St. Kitts and Nevis that gets bandied around a lot. We have subsidized services. Nothing is ever free. Somebody's actually paying for it. So you have subsidized services. So it's that's the same thing. It's not. You must make, as we stated earlier, coverage is defined as having paying or having paid on your behalf, whatever is that contribution. Then it is not all things to all persons. There is no medical coverage system that can cover all diseases from diagnosis to end, because or else you're asking for coverage that is multi-billion-dollar.
Yes.
Because there's some treatments right now, if we even take the dialysis system, 3 days a week, I think each is probably like 18, 20 or something like that. Multiply that by 3 times a week, 52 weeks a year, and your average, the life expectancy for St. Kitts and Nevis is 75. And right now you're 30. You're 35, have need for dialysis. Do that math and tell me if there's any insurance company you can realistically get to cover even 80, 70 or 60% of that. So that's where it's telling persons the steps first calls for you to do as much as possible to remain healthy. Then if you happen to have need for insurance, to follow through with the protocols that the doctor says. So we expect to see some medicine chests start to be less cluttered with old drugs, and you cannot take back old drugs because you know you had a cold last month and you take the same thing you had. So we expect to see a lot less clutter. We expect to see more health-seeking behaviors, and then also we expect for persons to hold the system accountable. One thing I've never fake petitions for. Once you're paying for something, you are in there. So I expect you to be in there as well. But be in there with the people in your household who are also not paying, and tell them to pay as well. But then also let us know if you're getting the best quality of service for the contributions that you're paying.
Well, Ms. Clark, I want to thank you so much
You're most welcome. It's always a
for being
pleasure.
on today's program, and I'm sure you will come again.
Yes,
At
yes.
some
Once
of
we
the
have
point.
the numbers crunched and all of those,
Right,
some
and
more
it's still a work in
concreteness.
progress.
Yes, of course.
You know, you have consultants and you have people coming in and so on. And I am sure that in the end, all the questions will be answered
Yes.
and it will work out just fine for the people of St. Kitts and Nevis. You have been listening to another edition of Working for You. Today, my guest was Azilla Clark, who is the chair of the St. Kitts and Nevis National Commission on Universal Health Care. We want to thank all of our listeners to today's program, all those who called in and asked their questions, made suggestions, and so on. We thank you very much. All those of you who just listened and understood a little bit more in terms of what is being done with respect to universal health coverage here in St. Kitts and Nevis. Next week we will be back for another edition of Working for You. We will have on the program officials from the Ministry of Aviation. See you next week, I am your host, Lesroy Williams.
Working for you. A weekly talk radio program which highlights developments of national interest and the activities of your St. Kitts Nevis government. Join host Lesroy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts Nevis. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for you is weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for you.